We sold our souls and have nothing. I was struck by this quote from Dr. Mazarek, who's a professor of anesthesiology at Yale. And the reason he said this is because so many physicians now, 78%, are employed by large equity groups, hospitals, and private organizations. So they've given up their private practice and they've given up their autonomy. And what were they promised in return? So number one, they were promised that they would have more patient access. What's actually happened? There's less. It involves patients being very digitally savvy to make appointments, confirm appointments, and pay for appointments. And so what's happening is very few people and less people have access and ability to make these appointments. Access has gone down. Secondly, costs. Now let's look at that. So many of us have sold our practice because we thought the costs were getting dangerously high of running a practice. Reduced reimbursements from insurance companies, increased pay for staff, and adding staff because of billing issues or prior authorizations, etc. So what's actually happened? So these huge fiduciary groups have come in and said, we will take care of your costs. We will lower those costs. What's actually happened? The reality is costs have increased in running these large organizations of physicians. And so what are they saying in response? They're saying you, the physician, has to start seeing more patients in order to make up for these increased costs, seeing your patients more efficiently, getting better reviews, seeing more new patients. So they're shifting all the blame for increasing costs. These are costs over what you had in your private practice and shifting them to you. These are all the things that physicians wanted to escape from. And number three, they promised physicians that they would have resources and funding to run better practices and to see patients and to provide services. None of that has happened. So of these three things, he makes it a point that none of these promises have come true. So we have sold our independence, we've sold our private practices, we've sold our ability and our brands and our names to large organizations that have not come through on their promises. Very scary. The best thing that's happened to physicians is now there's no enforcing non-compete clauses, so you can leave. So what happens with this? I mean, what can we do about this? Even though there's decreasing reimbursements and larger overhead, can we, the individual physician, control these costs? So my answer to that is yes. You can go back into private practice. Future talks will be about how we actually look at our practice. But one of my reasons for actually writing this book is to help you step by step look into everything to go back into private practice. So whether you're a graduating intern or resident or going back into private practice, it's a small book that says check, 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 check. So just a quote for you, someone that's in the system, and to think of what you've sold out on a little more critically.